Hello and welcome, everybody. We are excited to have you here as a part of our CCBHC State Technical Assistance Center webinar focused on opportunities for you all to work with your CCBHCs and use them to help build a strategic behavioral health workforce plan. So this is our funding information for this webinar here on your screen. You can follow along and read this as we send out our information later. Next slide, please. All right, so we have a great agenda for you all today. We will talk through several identified workforce strategies that have been identified through interviews and research of best practices for CCBHCs across the country that can be considered and applied within your own state planning. We will talk a little bit through about how, as state leaders, you can take the strategies that we share with you, both as at the high level, but also hearing from our workforce innovators panel today. So we have three lovely individuals joining us today from different states, also working at different clinics who are CCBHCs. Sharing some of the innovations that they have implemented to build, support, and retain their workforce. So we're really excited to share these practices with you and help kind of drive the juices for innovation within your own thinking within your own state work. Then we'll open the floor for you all to ask questions of our panelists, but also of Anne and myself. And then we'll share some of the resources as we move forward. I want to share that today's webinar is also part of a two-part series where we will also have an office hours on July 28th, which is next Tuesday, I believe. And the office hours will highlight of several state officials and their work that they're doing on a strategic level to implement partnership and innovation with their CCBHCs to support workforce. So today you'll hear from our clinic leaders, and then next week we will have an open forum and discussion on how state leaders can take practices and apply them within their work. Right, next slide, please. All right, so I had gone over this a little bit within our agenda, but today we're going to talk through strategies used by clinics and CCBHCs in the field to assess, prioritize, and strengthen their workforce. We will talk through the strategic and policy levers that states can use to improve workforce recruitment and retention and sustainability. As I had mentioned, we're going to hear from the CCBHCs and really listen to their practical steps that they've taken to support their workforce efforts. We'll go to the next slide, please. I'm going to introduce myself and then I'll pass it to my colleague, Anne. I'm Liz Remillard. I'm a senior advisor within the National Council for Mental Wellbeing, and I support states in their implementation efforts with CCBHC.
Great. Thank you so much, Liz. So hi, everyone. My name is Anne Ritter. I'm a principal with Bowling Business Strategies, also known as BBS. We're a national consulting firm that's focused on community-based behavioral health, and we've had the opportunity to work extensively with states and provider organizations on CCBHC implementation. We've been very, very lucky to work with the National Council on a variety of initiatives, including STAC. And through that work, what you'll hear about today is we've had a chance to engage with CCBHCs, with state leaders, and workforce experts from across the country to better understand what's working, what's challenging, and what promising strategies are emerging in terms of behavioral health workforce development. So we're excited to share those with you today. You can go to the next slide. Okay, so before we start talking about specific strategies, I want to ground us in why workforce remains such a critical issue for CCBHCs. And I'm sure that many folks in the room have personal experience with this, but just to kind of ground the conversation. As many of you know, the CCBHC model depends on having a robust and interdisciplinary workforce. And having the right staff in place is necessary not only for access and quality, but also for fidelity to the model. Workforce shortages at the same time continue to be one of the most commonly reported challenges facing CCBHCs across the country. And according to the report from the national evaluators of the CCBHC demonstration, nearly 90% of demonstration clinics reported staffing and workforce challenges. But at the same time, the good news is we've seen significant growth. CCBHCs have added thousands of positions nationally, with a median of 31 new hires per clinic, but the demand for services is continuing to outpace workforce supply. The good news, which you'll hear about today and also next week at the office hours, is that clinics and states are testing a variety of approaches, and today we'll highlight some of the strategies that are gaining traction in the field. Next slide. So over the past several months, as Liz mentioned, we've had the opportunity to engage CCBHC leaders, state leaders, and subject matter experts on workforce development as we've been working on developing a workforce resource that will be released later on. The feedback we received and the information that was shared helped us hone in on kind of these four major categories of workforce strategies in CCBHCs nationally. Nearly all CCBHCs are doing some of these things, and many are doing all of them. So when we look across workforce initiatives nationally, most strategies fall into four broad categories. So first is workforce pipeline, which focuses on building the future workforce. Second is recruitment, which includes attracting qualified staff into open positions. Third is capacity building, where organizations are developing their staff and trying to get the most from the workforce that they have. And then fourth is engagement and support, which is creating the conditions that help staff stay in the organization and thrive. So as we'll talk about today, and as we'll hear about from our panelists who represent CCBHCs across the country, the strongest approaches typically combine efforts across all four of these areas. Next slide. So let's look at a few practical examples in each of those four categories. For workforce pipeline, many CCBHCs are partnering with colleges, universities, community programs to create direct pathways into behavioral health careers. Some are also investing in internships, residencies, and even high school outreach efforts. So basically, instead of waiting for qualified professionals to appear, clinics can help create them through structured partnerships and supervised training opportunities. Later today, as part of our panel, you'll hear from Compass Health Network and some other CCBHCs. And Compass has a really cool early career engagement pathway. And some of their licensed clinicians first entered the organization as student interns. So that is kind of a real world example of how workforce development can begin years before a vacancy exists. For recruitment, successful organizations tend to treat workforce planning as a strategic function rather than simply filling vacancies. So this can include benchmarking compensation, trying to understand the local labor market, including the labor market outside of healthcare or behavioral health, for example, such as retail, which may be a competitor for hiring, and aligning hiring priorities with service demand and clinical goals. So the key takeaway is that recruitment is often most effective when it's connected to a broader organizational strategy. And also just the most effective recruitment strategies may not be a new marketing campaign. It may involve looking honestly at compensation and making targeted salary investments. At the same time, recruitment isn't only about salary. Helping candidates access loan repayment benefits can also be a major differentiator too, especially in underserved communities. Next slide. So the two other strategy areas focus on supporting the workforce once people are hired. So capacity building includes approaches such as team-based care, ensuring staff are working at the top of their license, investing in training and career ladders, and using technology to improve efficiency. So these strategies can expand access and strengthen services without relying solely on adding new staff. It could also include redesigning care delivery around a teaming model that maybe includes therapists, care coordinators, peers, support staff, so that everyone is practicing at the top of their license. And you'll hear a little bit more about that from our panel too. Something that's interesting to consider under this area of capacity building is also that the the focus here with regard to technology and data is thinking about them as more than just quality initiatives. Often in kind of CCBHC world, we think of technology and data and IT as being very oriented towards quality and quality measurement. But what we've heard from CCBHCs is that, for example, measurement-based care can be a workforce strategy as well by helping clinicians serve people more effectively, helping them manage their caseloads differently and more efficiently, and increasing their capacity to serve people. And then finally, engagement and support focuses on retention. So organizations we heard from, they're paying greater attention to supervision, workplace culture, staff well-being, reducing administrative burden. And that's a theme that we'll hear throughout today's session when we think about considerations for state leaders as well. What can states do to reduce administrative burden or streamline requirements for folks in these roles? At the same time, at the clinic level, many CCBHCs are tracking staff retention and engagement data proactively so that they can identify challenges early and respond accordingly. And there are also proactive efforts at the clinic level too to reduce administrative burden on clinicians, which, as many of you know, can be a real morale killer. And it can also honestly even be a factor that drives people out of community behavioral health as a field. And so reducing documentation burden either through technology like AI scribes, or even just by streamlining workflows or improving EHR interfaces at the clinic level, those are all things that are also additional ways to maintain a positive culture for the folks who work at the organization. So that's just a very high-level overview of some of the areas of focus for CCBHCs that are interested in taking steps to build and support their workforce. And what we've heard and what we've seen in our research over the past several months is that basically all CCBHCs are doing some of these things. For example, professional development and training is very much baked into the CCBHC model through the criteria. And the PPS has allowed many organizations to offer more competitive salaries. Meanwhile, some CCBHCs are truly leading the charge in terms of innovating in this area and are pursuing opportunities across all four of the focus areas. For example, there are CCBHCs that are doing really innovative work around tuition reimbursement for existing staff that go back to school to build their credentials, which has this kind of wonderful combo effect on both workforce development and staff retention. There are CCBHCs that you'll hear about today that are taking advantage of programs that help new clinicians prepare for exams and earn licensure by wrapping around them with this kind of wonderful suite of different kinds of support during that critical period of time. There are CCBHCs that are leveraging the flexibility of the model to redesign their teams and redesign care in ways that makes them more efficient and able to meet community needs wherever they are. And so later on our panel, we'll hear a little bit more about those clinic level innovators from CCBHCs who will share their own experiences about how they've decided to pursue some of these initiatives. Before we move on to the next part of our program, though, that's going to talk a little bit about considerations for state leads, we want to just take a minute and hear from the group, the participants here, about the perception of clinics in your state and where they're focusing their efforts related to workforce development. Next slide. So at this point, we've covered these four broad workforce strategy areas that clinics are using around the country. And so we'd like to hear from you through a poll. So again, thinking about the clinic level, so thinking about the clinics in your particular state, and also thinking about challenges. Which of the four strategies that we've discussed seem to be the most challenging to implement effectively at the clinic level? And this can be anecdotal, this can be your perception, but based on the examples that we shared and the topics that we've discussed so far, which of these four areas seem to be the hardest to implement at the clinic level based on what you've seen in your state? So we have workforce pipeline and recruitment. So those are sort of building the workforce and bringing people in the door. And then capacity building and engagement and support, which is kind of building the folks that you have, building the capacity of the folks that you already have, and engaging them and helping them stay and thrive in the organization. So we will leave this up for a couple minutes. I'll let my National Council colleagues tell me when we have enough answers to share the results.
Just giving a few more seconds. Okay, I think that's good enough time. Ending the poll and sharing the results.
Great, thank you. So looking at this here, we have workforce pipeline as the number one challenging area. And then we have a tie for the second most challenging area, recruitment and then engagement and support. Interestingly, capacity building is not one of the most challenging areas. And I do wonder if that links a little bit to sort of the fact that many clinics, even before CCBHC, was a model that people were trying to pursue, that professional development and training is baked into many of the approaches that folks have in terms of staff training and development. And then, as I mentioned before, it really is part of the CCBHC model that you have these different requirements related to staff training and development. Um, I'm curious if anyone, not to put anyone on the spot, but if there's anyone in the room who is possibly interested in sharing perspective on why they think workforce pipeline might be the hardest one for clinics to implement. And if you want to raise your hand or put something in the chat, either one is fine. But I'd be curious to hear if folks have any thoughts on why workforce pipeline is the hardest one.
Hi, this is Scott Ubner from New York State, CCBHC program.
Hi,
Um,
Scott. Thanks.
I think, the workforce development folks at the state have been working on that pipeline, and I think individual CCBHCs don't have the relationships with some of the institutions or organizations uh, that they need to be able to do that. And so the state is trying to capitalize on its relationships and some of the existing relationships that there are with universities to try to build that pipeline.
That's a great observation. Thank you for sharing that. Yeah, and I have a feeling many states can relate to that too, that there may not be sort of that direct connection across state agencies. That's actually, I think, a wonderful segue into Liz's portion of the presentation. Liz is going to speak a little bit about considerations for state leaders when it comes to the four areas of workforce development that we touched on. So Liz, I will hand it to you.
Yeah, absolutely. I think workforce is an interesting one for state leaders because um, we have a lot of influence on workforce in the behavioral health field, but we don't necessarily have, direct control or actions that we can take that would either have immediate influence or results. So I really appreciate that you all are here listening to some of these strategies, and then we can hear how state decisions or flexibilities actually can help clinics make those direct actions to support the workforce. So in the four areas here are some of the strategic actions that states can take that could allow clinics to do what they need to do to support pipeline, recruitment, capacity building, and engagement. So when we look at workforce pipeline, knowing the information that exists within your state and in particular with your CCBHC clinics is really the first step. So being able to track the information, whether that's through the data collection of your cost reports or a staffing plan template with your CCBHCs, it's finding the right data sources to help understand where the needs might be. But also, as I'll talk about it in a future slide, it's also about listening to your providers and hearing where they might be feeling the pains and being able to have them tell you how they can report where those the workforce capacity gaps are and how they might need support there for the pipeline to be bolstered or supported. Additionally, one of the pieces that's completely in the state's wheelhouse is around credentialing and approval of the types of behavioral health providers that can deliver the services within a CCBHC model. There may not be within the CCBHC team's area of scope, but working with those licensing or credentialing bodies to understand what the requirements are and how that does or does not align with the needs of the CCBHC services and the people who need the services to be delivered. So really finding ways to work with the credentialing bodies, or finding ways to adjust policy language, whether it's Medicaid or behavioral health policy language, to support flexibilities in the types of providers that are able to provide care to clients within the CCBHC model. For recruitment, states can take several different actions. Mostly they are a supportive role to encourage and support clinics to find the right pool of candidates for recruiting. So that would be through formal connections between CCBHCs and universities or other academic partners, creating a streamlined approach to support the bringing in of new individuals into the workforce. But also encouraging the recruitment strategies. And I know we're going to hear a little bit from one of our partners today on the panel about certain pilot programs that you could test or support within the CCBHC to incentivize candidates to maintain employment, individuals or staff, clinicians to maintain employment, and also level up or enhance their skill sets while also maintaining their employment. So that feeds into our next section of capacity building, where states can start to cultivate a space where resources are available to clinics on free trainings, state-funded trainings, or state-endorsed trainings that support the staff or the clinicians within a CCBHC. Many states fund behavioral health trainings and want to see the skill building within the behavioral health field, in particular around evidence-based practices, but also generally speaking, trauma-informed care or motivational interviewing, other best practices that we'd like to see within the CCBHC model. And being able to share those in a single place where clinics can go so they're not scrounging around trying to find the resources and wasting their resources trying to find the right information. Lastly, in capacity building, I think we've talked about this a lot over the last 6 years in particular, but ensuring that states are embracing and supporting access to services and access to technology delivered care, so that clinics can think innovatively on how they hire clinicians, potentially out of state, or allow clinicians to have a hybrid working environment, which would then move us into the fourth tier of engagement and support. So finding ways that it reduces burden on staff for behavioral health. And so one way is to enabling flexibilities like technology, but another way is to ensure that the policies and the requirements that we're putting in place for service delivery are there for a reason and aren't there just for data collection that maybe the state doesn't use. And so identifying ways to reduce administrative burden so that the clinics can have their staff and their clinicians work to the level of their licensure and their staffing responsibilities at the best possible, have the best possible space to do that. And then lastly, a state can serve as a collaborative convening role for clinics, bringing CCBHCs together to talk about workforce barriers. I had mentioned this at the very beginning with pipeline. It really comes all the way back to this, which is along each of these areas, we want to be listening to what the clinic's needs are because they will be ever evolving, and the community needs will also be ever evolving. And so states need to be responsive and reactive to that in supporting clinics so that they can continue to have a robust workforce. Okay, next slide, please. So I've spoken a little bit about these, and I can't stress enough that partnering with your CCBHC providers, the clinics, the associations, as listening partners, as partners who can provide input and feedback into your own initiatives is critical to having successful workforce strategic initiatives for your CCBHC model. Identify your state partners within your government agencies. Scott from New York mentioned that there's a workforce team that he can work with, or that is putting energy towards the initiatives in New York. I know other states like Michigan also have a similar strategy of supporting that, and you'll hear a little bit more about that next week if you attend our office hours as well. I had mentioned that leaning into your cost reporting as well as your CCBHC certification criteria, whether that's through your staffing plan, your PPS guidance, or even how you're defining the services and how services should be delivered within your certification is super critical to thinking through how that then affects the workforce that's delivering that care. Lastly, I want to encourage you all to think about beyond your walls of government and just the clinics, but are there other experts out there supporting workforce initiatives, whether that's universities, foundations funding pilots, and as I had mentioned earlier with your providers, your provider associations that may also be innovating and funding pilots to see if any of those can be replicated within your CCBHC model. Taking all of these steps and putting them into a plan of action and a timeline that could support and encourage quality CCBHC service delivery really is your big next step, and really thinking through how these all tie together. All right, next slide. Okay, so we have one more poll for you before we get to hear from our panelists today. We'd like you to think about the 4 strategies: workforce pipeline, recruitment, capacity building, engagement, and support, and share with us what areas your state has focused the most attention on and the resources that you've been sharing out with your clinics within these 4 areas. And if you feel like you haven't started yet, that's okay. What area do you feel like you will be starting to put resources on, or that you've been thinking the most about as a part of your CCBHC work?
Just gonna give folks a few more seconds and then I'll end the poll.
Great. So what I'm seeing here is that many of you are focusing your attention on that workforce pipeline, trying to close the gap of the staff and the clinicians that are needed within your CCBHCs or your behavioral health system. I think that aligns with where your clinic's needs might be, and I appreciate the responses here. Okay, Anne, I think we're ready for our panelists.
All right, great. Thanks, Liz. All right, so now we are moving into the panel segment of our presentation. And our panel today is great, in my personal opinion. I think it's a great group. And it's bringing together three people, three leaders who have been leading on the ground workforce innovation within the CCBHC model. So collectively, they have deep experience in employee development, staff engagement, organizational leadership, workforce strategy. And I think really important to us today is that they have firsthand experience implementing approaches that help CCBHCs recruit, retain, and support their workforce in what can be a very challenging environment. So we asked them to join this call today because we think it's important to learn from people who are doing the work every day in, day out, and hoping that their real world experience will help spark some new ideas about how you, as state officials, can be partnering with CCBHCs in your states. So we're grateful that they are taking the time to share their insights and lessons learned with us today. We are delighted to welcome Darla Young from Compass Health Network in Missouri, Trisha Welters from Grand Mental Health in Oklahoma, and Liz Worth from Johnson County Mental Health in Kansas to our panel today. So we have some questions prepared, and we also will have some time for Q&A from the audience as well. So if you have any questions that are sparking while these conversations are happening, take note of them, and we'll have some time for Q&A as well. So my first question is for Liz. Liz, can you tell us a little bit about your experience with the Workforce Accelerator program? As I mentioned briefly before, this is a really interesting program that supports licensure for new clinicians. How has that experience been? What workforce challenges were you trying to address when you began that journey with it? And what successes have you seen so far through the program?
Okay. Yes. So Kansas was a state that was selected to be a part of the Workforce Accelerator program through the CCBHC Transformation Grant that was funded through the Balmer Foundation. This is a new pilot project and something we're very excited to be a part of. And as that goes, it's a new project, and so we're just sort of figuring things out as we go. But in essence, the workforce accelerator piece of that grant is to naturally help build the workforce and provide some resources that we've typically not had access to ourselves. And so, for example, at Johnson County Mental Health Center, we had a system in place for, we have employment-based practicum opportunities for people to get a license. And then we had at the other end of that, a stipend for when someone does receive their clinical license, but nothing in between. And so we didn't have any way to pay for license exam prep or the exam itself because our tuition reimbursement we're part of county government, so that always makes it interesting. And we weren't able to pay for some of those things through those traditional resources. So what the Workforce Accelerator has given us is reduction in that barrier, and they allow us for our clinicians to take advantage of professional development, exam prep, exam test, or to pay for the exam itself. And really all they have to do is meet these milestones over the 2-year period. So really the biggest thing is it's removed that financial barrier for them and is helping people get there quicker because they're a little more motivated too. They're like, oh gosh, I have this opportunity to get this financial incentive and I can finish my license and get my clinical license within a couple of years. So that's really been a great part. In terms of how it's helped strengthen our workforce, it's really, to a couple of slides ago, that point of it's really expanded the pipeline of licensed clinicians, and more clinicians are reaching that clinical license level faster with fewer setbacks. So a lot of times when you have newer clinicians early in their career, there's a little bit of attrition that happens and they struggle to complete that pathway because there are a lot of barriers. It's a lot of work. It's a lot of time. oftentimes people have to pay for clinical supervision out of pocket. And when I look at those costs, I don't know how people do it. So, we're able to offer that in-house as is. And with part of the Workforce Accelerator program, if we weren't able to, there's a piece of that built into that program as well, where clinicians would have access to a third party to provide that supervision. So it's really also helps builds that clinical competency through the standardized prep material that is offered through that program. So I think that's fantastic. So there's so many good things, including like organizational capacity to attract and retain licensed clinicians. That was one of the reasons why we wanted to do this, is to retain our employees. And, we put a lot of effort into it and want to give them more so that they stay. And then for Kansas, I can only speak to that. It's really has a statewide impact, because all of the community mental health centers in Kansas became CCBHCs through that was written into our legislation. And so while if someone participates in this program at Johnson County Mental Health, but they move to, let's say, Wichita, they can continue this program in Wichita at the Community Mental Health Center, CCBHC there. So while we'd love to keep them at Johnson County, if they do move, that's okay, because they get to continue it. And then that CCBHC gets to continue to grow that clinician. So I think statewide, and even with the other two states that this Workforce Accelerator is piloting, they would be able to transfer to those sites too, which is pretty amazing. So I really think, the overall goal of CCBHC is to increase that access to care, and stronger workforce directly impacts that. So I think it's a win-win in what we're doing. While we just really got started this month with the full on, the clinicians are now getting into all of the professional development that they have access to. We don't have any like successes yet, but what I have really felt is, in my opinion, your largest return on investment is your staff. And I hear staff coming to me saying, "Oh my gosh, thank you. This is such a cool program. I'm getting paid to get my clinical license. I'm a little bit more motivated than I was, and now I'm going to up my hours." And so people are really excited to take advantage of this opportunity, and it has like just given a little morale boost in a way. So in my opinion, that's an early success, and we'll see how the rest of the time goes with it.
Wonderful. Thank you so much, Liz. That was a great overview of the program. I think one of the things that I love that she mentioned is the idea that it is sort of the statewide approach, and that workforce, sometimes workforce, you end up talking about it where it's like we're competing for talent. But this is a model where it's sort of more collective, and you sort of see these investments in the behavioral health workforce benefiting a wide variety of clinics and CMHCs and CCBHCs. So that's great. Thank you for calling that out.
Yeah.
Great. Well, so I'd like to shift to Darla now. So Darla, I would love to hear a little bit from you about your experience at Compass Health Network. Compass Health Network has taken a really comprehensive approach to workforce development and retention, including scholarships and other sort of structured support and leadership development programs for folks. And so how have you combined those initiatives into a cohesive workforce strategy? And which investments do you feel like have had the greatest impact on recruitment or retention or staff satisfaction?
Yeah, thanks, Anne. So I want to start with a really honest overview, because we're pretty far down the road on this topic. So I don't want all the things we're doing to feel overwhelming. And I like what Liz said when she said, people get so excited, they see a path. And that's what it's all about, ultimately helping our community. So when you hear what we're doing, please know that wherever you're at in your journey is amazing, that you're on the journey. So the cohesion question, here's a really honest answer for those of you that will appreciate this too. It didn't start that way. The premise, it was not cohesive. They grew up very separately. We had tuition assistance, we had cost agreements for licensure fees, we had our supervision hours, our scholarships, and they all solved a really really real problem in isolation. But what we've been doing since I've been tasked with this over the last year and a half is when I kind of was tasked with finding a way to connect all that. And I just want to be honest that we didn't start with this whole big, great program. It started from individual things that grew. And we realized, wow, we need to put all these together and really make this a focus because employees are responding to this. And that helps with that pipeline that many of you mentioned you were concerned about, one of your biggest areas you want to think about and where you're putting your money. So what connects all of these things now is that single idea. We've removed the barrier between the employee and the credential that a career in mental health requires. Sometimes that barrier is tuition. Sometimes it's simply a $400 exam fee. Like we can help with that. Let's help them get to where they need to go. It builds loyalty, it builds their confidence, and that's what we want in our clinicians. So sometimes it's also finding that supervisor for supervision hours. For 3,000 supervisor hours that are required. So it's all the same strategy, but the obstacles are very different. So we were very fast to name that. Some of these are easy fixes and some of these not. So the piece we recognized we were missing against all of these great programs was leadership in those programs. All three of those individual investments that we were happening, somebody's degree, some person's license. So we launched, right now it's happening, it's called Compass Lead, Leadership Exploration and Development. And it's a 6-month pilot program that I put together through a lot of research, complete with a 360 evaluation and lots of tools we use. And right now we launched with about 25 high potential employees because we realize that to develop our employees, we have to develop our supervisors because they're the key to our employees knowing what's available and who those individuals report to. It's very parallel to be successful in our development world if we have to be successful with our supervisors. So we've just started doing that program. If any of you would like more information, we're always happy to share what I've learned and save you a little bit of time and effort. So which investments have had the greatest impact was another question that you asked. And on retention, I have 3 numbers that kind of shows the growth, and we can probably assume some retention there. So tuition assistance, our program, has grown from $146,000 annually to $671,000 in the past 4 years, from 84 applicants to 183 applicants. So of all of those applicants, 36% have come back for a second award year. Now that could be because they were just finishing something up they started, or, they were just at the very end and they found out about our program and they participated. But it requires them still being employed. So that's solid data. We can say people came back. And I understand that's a proxy. That's not a controlled comparison, but it is real and it is data and it's what we found. The bigger surprise is our smallest program, which is this something we simply have for cost agreements, where we pay licensure and supervision certification fees. I'm sorry, take out the supervision and let's just say licensure and certification fees, because supervision is obviously a much more expensive task. But those licensure and certification fees, which to keep people licensed and to keep them certified, it's only about $547 a person. Now, I just did a quick little data check. I checked 83 folks and only 86, and only 4 of those 86 have left. That's a pretty good retention number as well. We've had a lot more, but that's 95% of the investment for those 86 people. They stayed here. And dollar for dollar, that is the highest return thing we do. And it's very easy for any of us to duplicate. It's basically a lot of time and effort, but a really high payoff. Licensure supervision program has moved 313 staff to full licensure in the last 4 years. I'll also tell you that a third of those people who entered the pipeline of licensure supervision were not able to finish. And I'm guessing that's a problem for a lot of us, that we find our people do not go the distance with those 3,000 hours, because that's a lot. But the cheapest program that we did, the cost agreements, has the most memorable data. And it's a small thing that makes a difference. So in our recruitment and satisfaction piece on that, how it's helped, our satisfaction data from last year for Compass, we had a 96% satisfaction rate with the entire organization based on our annual engagement survey. 2026 is in process, so we don't have that data yet. Our tuition assistance program appears in our postings, comes up often in interviews. We have a lot of awesome master's degree graduates who now are ready for licensure. And as I believe it was Liz pointed out, they don't have the money to get from point A to point B, and we help them with that. And we partner with 9 universities across the state as opportunities for people to be a part of their program, and we pay them a higher reimbursement for scholarship if they go to those universities. We know their programs are solid and vetted, and they appreciate us working with them, and we, of course, appreciate the opportunity. But I cannot really tell you how many hires we lose without these programs because we just don't ask that question systematically. We just don't. Our recruiting team does share our development program with all our potential candidates as a factor for the role. We also make sure our supervisors have lots of resources to talk about development, including a document with lots of clickable links. So whatever their employee is interested in those one-on-one conversations, in just a few seconds, they can get to more information about that program. So let people know what's available, let them know what's possible, and let them know that we're here to help and we're here to help you be your full potential. And we want to make sure that we grow our own here at Compass and that we keep people interested in their career at Compass, not just their job. So the one gap I would name in the room real fast is I would like, and I'm going to now gather this data, compare our retention between our participants and non-participants with our development programs because we've never built a termination date into our tracking. So that is something I learned that maybe now you can take with you when you're building your individual spaces. So thanks so much.
Thank you, Darla. That was great. And you wove in so many different aspects of some of the best practices that we talked about. It wasn't just about, a leadership program or tuition assistance. You talked about how you're using data to track all these different metrics related to workforce and retention and staff satisfaction. And that's a wonderful thing to take away from this as well, is sort of how can you build that kind of approach into the way that you handle employee engagement, HR functions, and things like that. So last but not least, let's switch to Tricia. Grand has been rethinking how care teams are organized through an interdisciplinary approach. It's been a while since Grand first became a CCBHC, since you were one of the first CCBHCs in the country. And so I'm just sort of curious to hear a little bit from you about how the model of care has evolved, what lessons you've learned about engaging staff and sort of supporting leadership development during the course of Grand's transformation into the CCBHC that it is today.
Yeah, thank you so much. So I will say that it has certainly continued to evolve. I'll talk a little bit about where we began this journey. We really focused on a workforce design that would allow us to stretch capacity. The other two have talked about some really great programs. I actually jotted down a ton of notes, even again today. And we do some of those things, and they are certainly building our workforce pipeline and creating more engagement. We decided early on that our treatment team model was not sufficient for the workforce shortages that we were continuing to see. And so how could we fill the gaps in the different roles of a team? We do a lot of things in teams at Grand. I think a lot of leadership around here played a lot of team sports when we were children. And so you just we don't really like to do anything alone. I don't know. We probably should think about that, but we do a lot as a team. And so we built this team of a master's level clinician, a bachelor's level clinician, and a lived experience clinician. That was kind of the core members of our team. We elevated that master's level clinician to really a management role. We gave them the leadership and oversight authority to become truly the CEO of their caseload. And we saw talk about kind of just lights come on inside of clinicians who really found just the spirit of being able to truly feel like they were guiding the care of those who were placed on their caseload. Um, in addition to those members, we also had advanced practice providers, nurses, psychiatrists, kind of all wrapped into that team as well. What that approach really allowed us to do is we talked earlier, you all talked earlier in the slides about tasking each level with working really at the top of their certification or licensure. So we didn't have therapists really focusing on case management work because no one else on the caseload was focused on that. We really were able to have them do the top level that they could. We saw caseload numbers grow, which normally is a negative thing. But for us, it actually having larger caseloads than ideal really worked out. And that's where we really found the stretch, the capacity to be able to stretch and serve more people. We were very worried. Darla talked a lot about data. We ran a lot of data to see if our outcome measures were falling because caseloads were growing in this approach. And we actually found that they weren't. So clients were getting specific needs met by different members of the team, maybe not always the therapist or not always a lived experience clinician. They were also finding different connection points that seemed more meaningful to them, which led to greater outcomes. So we really felt like this was the way to go. We're probably in the third version of this now. I think since we became a CCBHC, I want to say it was early 2017. It may have even been 2016. I'm not sure when that happened, but we continue to see success with this model, and clients really feel supported. We added some additional members to that team, so now we have a clerical support team member that really also gets introduced to the client. A lot of times those behind the scenes staff don't really have interaction with clients. We thought it was important that they know that they're just another person who could help them with, an application of some kind or to get an ID or even some of those case management type functions. And so that's been really beneficial as well. Let's see. We we shared productivity. So it's interesting. This was my first stop in healthcare. I've spent almost 30 years in the HR world. And when I first arrived, I asked some questions about data and I said, okay, when do we talk about financials? I had come from, for-profit world and all the other things. This is first healthcare, first not-for-profit. And they said, oh no, you never talk about financials to clinicians. They don't like that. And so I was like, are we sure? Like, who told us that? So we started really with this model, empowering those master's level clinicians to have productivity data, to have financial data, to really engage in the entire process, not just that front end direct care, but the entire process. Again, empowering them to be the CEO of their caseloads, which did allow their caseloads to grow much greater than most people might be comfortable with. But we were still seeing positive outcomes and everybody was bought in. So I think it also showed them, I think, the business side, the compliance side, and just really has developed a well-rounded level of clinicians. We have a tremendous pipeline of leadership coming out of that master's level clinician staff base because they're ready. Their readiness is there, and it's kind of baked into what they're doing right now. Let's see. I feel like there's one thing I'm forgetting. The last thing that we really added, I would say, is a performance-based incentive plan. So when you talk about compensation, that's always important, especially in a workforce shortage and trying to figure out what sets you apart from others who may be hiring the same clinicians that you are. And we felt like because we were giving them so much transparency into the work that they were doing every day and what that meant for the organization and what that meant for the clients, we felt like performance-based compensation was a real shift for us. And it was a tremendous shift for us. And we're still working out a lot of the kinks in that, but we are seeing kind of coupling all of those together, really seeing tremendous outcomes on both the client side, meaningful outcomes on the client side, as well as just staff being engaged and staying with us. We have an 11% turnover rate, which is very different than a retention rate. I will say that. But I think when you work in healthcare and you see averages of 25% retention in our outpatient settings, we're hovering in the 11% range at all times, which is fantastic. We entered this model hovering right around 22%. So to see that really cut in half has been truly meaningful for us.
That's wonderful. Thank you so much for sharing that. Yeah, and you highlighted also so many important things in what you shared. I think one of the things that stuck with me too is just this idea that it's an evolving approach, right? It's sort of the CQI mindset where things have changed, you've tried different things, adjusted the way that you do it, and are gradually moving towards a better and better version of how to deliver care. And so I appreciate you sharing everything that you did. We are getting close to the top of the hour. I would love to just keep talking. I don't know if we have a lot of time for questions. I do want to make sure that we have time to sort of get through some of the final slides that we have here. Our panelists, though, I'm sure would be happy to talk to anyone who would be interested in learning more about what they do. If you guys want to put your emails into the chat, you're welcome to. Otherwise, if folks who are on the call want to speak with anyone who participated in the panel separately, we're happy to share that information. Next slide. Like I said, I'm not sure if we have time for Q&A, so why don't we go ahead and move forward? All right, so I think just a few key takeaways. It's really important just to recognize that CCBHCs can serve as powerful engines for strengthening the entire behavioral health workforce. As we mentioned before, benefiting not just their own organizations, but really the broader system of care as well. CCBHCs are important partners to academic institutions, state agencies, and local organizations when it comes to building workforce in the communities that they serve. State leaders have a role to play. And again, putting in a plug for the office hours that we'll be having next week. We'll have state leaders from 2 states who will come and speak a little bit about the workforce development initiatives that they have been launching in conjunction with CCBHC. And just to note, the PPS model is an important part of this as well, because it enables investments in workforce that maybe are not possible in a traditional kind of fee-for-service context. And so that is an important thing to keep in mind as you are making decisions at the state level about PPS. Next slide. So we will send out these slides afterwards. Here are a variety of resources that may be of interest to folks on the call. Next slide. Some more resources, including a link to the Workforce Accelerator program that Liz mentioned. That's the last one on this slide. So if you're interested in learning more about that specifically, that's here as well. Here is information about the Workforce Office Hour for state officials happening next Tuesday. I know that our National Council colleagues also put the link for registration into the chat. So please, we encourage you and also maybe colleagues who weren't able to join us today to sign up for that. Next slide. Here's some additional information about how to get in touch with the National Council team. And again, a couple specific links related to the Workforce Accelerator program. And with that, I will pass it to my National Council colleagues to talk about evaluation surveys or anything else that we need to do to wrap up.
Thanks, Anne. I will be launching a poll for you all. Just if you don't mind taking a few moments to help us with our evaluation and continuous quality improvement efforts by answering these questions, and just let us know how we did and what we can do to support you in future sessions. So the poll should be popping up on your screen. We'll give folks just a few seconds here. I know we're at time, so if you all could answer quickly, that would be great.
Thank you again to everyone who joined us today. Thank you again to our wonderful panelists, and we appreciate you taking the time with us this afternoon.
Yep, and we're just gonna end it in just 10 more seconds. All right, thank you so much. I think there might be one more slide. I could could be wrong. All right, so if you're interested in receiving CCBHC State Technical Assistance, feel free to click on the link and fill out the form. And just wanted to thank you all, especially Anne and Liz and all of our great panelists for sharing your experiences related to workforce strategies. And I hope you all have a great rest of your day. Thanks,
Thank you
everyone.
so much.